you. Thank you very much. Thank you, Chair.
Thank you very much. I will follow with, we're still trying to reconnect properly our dear colleague, Senator Umidva. So maybe I'll jump in with one quick question that I did ask last week. But, you know, in this study, we're really trying to understand if the government's response to the COVID is making its way to helping Canadian. Really, that's, you know, that's the bottom of what we're trying to achieve. So I would like to hear each of you briefly on whether your organization is because the government did commit, you know, even if at some level it is provincial jurisdiction, the government did commit in his official response to communicate, to gap some bridges and to help. So is this in fact happening? Are you seeing it via your organizations? And so I don't know if maybe Madame Ladd, you want to begin and then Ms. Ferrier and then Monsieur Boyer.
Yes, I mean, I have to say that the kind of quickness, I mean, I think we were all kind of taken off guard by the national pandemic, worldwide pandemic. I do believe that CERB has made a huge difference to the lives of people. I mean, we know now 8 million people are on CERB, and I think that as the government found out, there were barriers such as part-time workers. For instance, they sort of dealt with those issues. So I think that was fantastic. I do think, though, that a valid social insurance number should not be a barrier, especially when you're dealing with a health crisis. You want to make sure that cleaners and construction workers and all the kinds of workers that are doing the work that is largely invisible, that a lot of undocumented workers are doing in our communities, that they also are allowed to stay home and get some benefits. And so for many of the people that we're working with, especially undocumented cleaners and construction workers and dishwashers and all those kinds of jobs that are, that we don't like to really talk about, those are the workers that have been without benefits since March, and they have greatly suffered through this. I was just this past weekend delivering a food basket to a man whose wife just had a baby and they haven't had income for 2 months and they are on the edge. And so I think that we need to be thinking through, especially when you're dealing with a health pandemic, you cannot have a valid SIN number as a requirement. Other than that, I think the CERB is, as I've been mentioning many times, I think it needs to continue. It cannot be stopped on July 4th because many of the industries are not reopening, and especially where low-wage workers are impacted and affected. This is the only thing that is stopping them from losing their housing right now. And so I think that it leads to another conversation around what happens around benefits like employment insurance afterwards.
Thank you. Ms. Ferrier.
You know, to go what Dina just said, a lot of our workers, personal support workers, are part-time, especially the ones in home care. And that's where we're seeing the hit for personal support workers, is they were already part-time. And then with the cancellation of visits, you know, there's not enough work. They dropped from maybe 45 hours a week down to 5 hours a week. And so a lot of them opted to take the CERB. They haven't had an issue getting it. From what we've heard, we've been able to assist them and direct them due to our relations with the provincial government and the federal government. They've given us that information and we've passed it on. Now, the rest of our workers that are in long-term care or licensed retirement homes or public home care, they have been actually singing the praises of the government in our groups as of late, as they have been receiving the PPP. So far, so good from our end.
Merci. Monsieur Boyer, brièvement, avez-vous quelque chose à rajouter?
Oui, c'est à moi, j'imagine.
Yes. I think that I said this in the beginning. We have to remind ourselves that in the early days of the pandemic, the federal government had decided to boost up the EI program. And this concerned us because, well, it has to be managed. The EI program has to be managed. And it was a good idea to implement the CERB and the wage subsidy. The CERB was quick and people had access to money very quickly, and that program had to be implemented. But as I mentioned, there are some industries that are these programs will have to be extended for some industries. A lot of work remains to be done on the medium and longer term, especially when we look at our healthcare. We have to start working on this now. If we were talking about home care or private care residences for long-term care, there were problems before the pandemic. These problems were amplified during the pandemic, and we do have to clean up the situation, and we have to give the seniors and people in need the services that they deserve. Thank you.